Kia ora koutou katoa, ka nui te mihi, a tipu ahau I te raro I te maunga o Temahanga, e tipu ahau I te taha o te awa o Mahurangi, e tipu ahau I te taha o te moana o Omaha, ko Preston tōko ingoa whānau, ko Sarah Elliott ahau, kei Tairāwhiti ahau I noho ana. Kia ora everybody, my name's Sarah, I'm the General Manager for Supergrans Tairāwhiti. I hail from Warkworth, north of Auckland, and my husband dragged me back to Tairāwhiti some 10 years ago, which was such a great decision. We're raising our 2 young daughters here, and this place is very much in both of our hearts. My background's in social work and human rights work, and I've been the manager at Supergrans for about a year now.
Kia ora, ko Rosie Allan tuku ingoa. In September of 2021, I started as a Manaaki Tairāwhiti Navigator for CCS Disability Action. CCS is a pan-disability support and advocacy organisation. After 2 years with CCS, I went for a short stint overseas before returning in December of last year to the Navigator or kaiuringi role, but this time for Supergrans. My background is in education, mainly early childhood, where I worked as a teacher in Wellington for a number of years.
And so Judy said before that some people can't speak as eloquently because we're in the trenches. I like to see Rosie and myself as some of those people in a very diverse charity, busy rolling up our sleeves and doing the do. I also want to say today we're just speaking on behalf of Supergrans and our experience of having a navigator in role and putting some of this new way of working into practice. They're only small steps, I feel like we're only just beginning, but they can highlight some of the things I think that are possible. And I know all navigators have quite different experiences, and managers and services that have navigators also have very different experiences to us. So I just want to acknowledge that now. Also, I just want to acknowledge 2 board members of Supergrans in the room. We've got Meri Pohatu and Te Aorangi over there. They're wearing different hats, but nice to see you both. Is this where I'm meant to point it? Over there. Ah, no, I've gone too far. Bear with. I'll go back one. Okay, here we go. Awesome. So a little bit of background on Supergrans, what we do just in a nutshell, and whether our navigator fits into our work. We are a charity that focuses on enabling whānau with the skills and the knowledge to take greater control of their own lives, so an empowerment approach. We respond to people in crisis and emergencies. We provide a safe space for people in need and to get the help they require, to build life skills, basic 101 life skills that so many people in our communities miss out on and was never handed down to them. So starting from that sort of ground level. We give opportunities for knowledge sharing and connecting through a range of workshops, and we're about supporting the development of food security for people living in hardship in Tairāwhiti. We work with anyone despite age, gender, ethnicity, financial status, anyone that comes through our door. We aim to help and support to be where they need to be. And we often find that people turn up to our doors after being unable to access other services, not knowing where to go or who to turn to, and hitting barrier after barrier as they're trying to help themselves. We work directly through these services here, so workshops, parenting, kai support, which is both in the food bank, which most of you know, but also more educational kai literacy, cooking workshops, financial mentors, and social support in terms of social workers and fieldwork coordinators. And the navigator for us is linking under all of these. They do not provide, and they should not provide, a service themselves, but they're helping to link in and out of these systems, both within us, within the community, and connecting those together. So how does a navigator work in practice? I hear you all ask. So some things that we've noticed and experienced since having Rosie on board for the last year. I really value the whatever it takes approach. As an organisation that's funded by 6 other big contracts, we have 10 full-time employees, most under different contracts. I've never seen a contract that's so flexible just to get the work done that needs to be done. Most of our other contracts are guided by numbers of clients in service or about outcomes. Have they got into a job? Have they got into housing? Have they got into employment? These contract specifications prevent our other kaimahi, amazing as they are, to do the work with specific people or support people in the ways they need because they do not fit the criteria of the contract. This isn't the case for the Navigator, who can help anyone with anything. It's my role to try to test and push those contracts and find ways to support our kaimahi to do more of this work. But as you can imagine, it is really challenging when you're in my role and you've got to write the reports and how you're meeting those. The Navigator's extremely flexible. We've found that systems are always changing, both locally and nationally, and what might work for one whānau to get what they need 1 month changes for another whānau completely the next month. So whānau need someone who is patient, flexible, supportive, and willing and able. Someone who's able to test and trial system time after time, very patiently, may I say, and to trial those processes, who can follow and walk alongside whānau despite the time that it takes and despite the amount of barriers and going in and out of different services that might also be needed. And Navigator has a flexibility in their role and their contract to be able to do that. I believe, as someone with a background in social work, specifically abuse work, that the flexibility really allows prevention of harm. People talk about prevention a lot in social services and sometimes I think it's not used in the right way, but for someone that can go in for quick, easy fixes alongside whānau to get what they need, small actions can prevent whānau's frustration, their anger, their stress, the pressure on already stressed people. These small things can help them get what they need and quickly move out of a system that's probably also causing them a whole lot of harm. And realistically, it's important to note that anyone can do this work. It doesn't need to be a Navigator, it's just the Navigator has the flexibility to do it. So if people have the permission within their organisations or their ability, then it could be happening. I've previously seen in many social service organisations that for whānau to get what they need, they have a referral, few people read it, it goes to a table or a triage, they jump through hoops. They have to do multiple complex assessments, even if it's not about the thing that they really need or are at your door for. Endless paperwork, push-pulled, referred out, not my role, don't meet the criteria, which is never the case for the Navigator. Another thing I'm noticing is this idea of group thinking. We're noticing the way of working being socialised throughout our charity and to many of our other people and roles. This is happening through team consults, through peer supervision, team hui, and just general discussions. Our kaimahi are all together in a small room, so it's constant discussions and all of the way of working and all of Rosie's sort of key words are being infused throughout what we do. And by supporting, teaching and sharing in all roles, it aids Supergrans as a whole know what's happening in our community. By all sharing that together, we can see, we can change, we can be malleable to know what's happening in our systems and services. I'm also noticing that our other kaimahi are starting to capture whānau voice, pure whānau voice, instead of trying to manipulate a whānau conversation into whatever their case note says they need to do or tick box they need to do. So we're starting to see that happening. And a small example, our amazing receptionist used to say, sorry, I can't help with that, or direct someone to a very generic service, like a very generic mental health service for something that might not necessarily be that, because that's what she knew. But now we're seeing more discussions in the initial engagement, ensuring people are supported to the actual right people, to the actual right place, usually awhi'd along, sometimes with a direct and accurate contact, so a whānau isn't just ping-ponging around. We've witnessed that whānau are really openly engaging with our Navigator. There's something very non-threatening about the role, the title, the approach. The bottom-up style seems to remove any of that power dynamic that can really create resistance in whānau engaging. The Navigator can create strong relationships by being alongside the whānau and not within a specific system or with a specific agenda. This is something our other kaimahi have commented on, our social workers specifically. They also seem to notice, they feel that this Navigator gets a higher success rate in quickly getting information from other services. Our social worker that used to work in Oranga Tamariki talks about to get information, the many requests, often through legal systems, long time for results and often very vague responses. And even in our charity setting, she notices that the Navigator is sometimes able to get information more quickly and she still gets more pushback. And I think it's interesting to reflect on why that might be.
When I saw the job advertisement for the Manaaki Tairāwhiti role at CCS Disability Action, it seemed to be a pretty blank canvas and I wasn't quite sure what to expect. I soon learnt that if I was walking alongside whānau with their consent, responding to what it was they were asking for, not doing anything illegal, and testing out how the system was responding while documenting barriers, then I was actually doing okay. When I started, one of my first learnings at Manaaki Tairāwhiti came from a conversation about what matters to whānau. What really stuck with me about what mattered was that whānau were heard without judgment. This gave me the confidence in continuing to do whatever it takes to support whānau to get what they need, learning to coach to whānau while reflecting so that they may know where to go themselves in future if they had to. I continue to be transparent with whānau, communicating with them if I'm not sure of anything, but seeking expertise and knowledge to find out as best as I can. There were many learnings, as there still are now. Not that I thought this at the time, but I think there was value in not knowing much at all, as I truly feel that I walked alongside whānau, testing the system's responses and learning alongside whānau to document barriers, as I, like whānau, did not really know where to go to access something at the beginning. This can still be relevant in a system that's always changing. Many practitioners seem willing to help, but a common phrase heard is, "I'm stepping out of my lane." At times, it's common for something to be offered in place of what the whānau are really asking for. For example, "I'd love to help with the sun hat, but I can't, so here's a pair of togs instead." Some of the referrals for the whānau came from those with large multidisciplinary teams behind them. One had 26 other agencies enrol, and a navigator was still being asked to come on board. Agencies wanted her to send her kid to school, but what she wanted was to first relocate to a new home, as she was worried about their safety when being threatened constantly by the neighbour. 3 years on, I am still enrolled with this whānau, but after the collective applied the way of working, hui's are now held with purpose to respond to the whānau-led plan. In this role, there is so much value in the lack of timeframes, as I didn't need to close the case when the whānau crisis softened. At times, I won't hear from this whānau for a few months, but when they need to, they reach out, or agencies will work together for prevention planning when things like school holidays are coming up. I've really learnt about how trust and true engagement does take time. I have learnt so much about all of the systems working in this role, and that there is no one-size-fits-all standard model for response. I've learnt to be creative, ask others for help, and to not take everything at face value. One of the coaches, Lane, always says, "Don't call your social worker if your kitchen's on fire." And this thinking has meant I do my best not to overreact to circumstances in crisis mode. I've learnt to give the agencies and the system a chance to respond, and to let whānau also breathe, respond to their own situations as well, rather than having knee-jerk reactions with unintended consequences. Over the 3 years I have been in role, over the 2 provider spaces, I have spent time at Manaaki Tairāwhiti fortnightly to come together with navigators and coaches. Many other agencies question how I am supervised. I have weekly coaching sessions to reflect, learn about the way of working, how to capture whānau voice. I find value in this time as it prevents me from falling into an organisational business as usual. When I was at CCS, whānau voice was captured in an Excel spreadsheet, but now more recently it's captured in Uringi. Whānau voice is input exactly how a whānau has asked me for something. Uringi can be used on the go using my phone. The purpose of the data is to show the barriers that whānau are facing from their own real life experiences when they're trying to get what they want. KPIs don't capture true whānau voice and are not a true reflection of whānau experience of the system, but rather are in place to capture practitioner performance. At times, I may only support 2 whānau in a week who require intensive support and have many things happening for them. Examples include health and disability, homelessness, family harm, truancy, amongst other things. Other weeks, I might support several whānau with more straightforward needs, like transport to an appointment. A KPI system would not reflect the hours that I spent with the 2 whānau that week, or the time spent might be paraphrased, missing the true purpose of my visits. I might be reprimanded at agencies in a business as usual system for my lack of numbers that week. To ensure true whānau voice is captured, I will check with whānau that I have captured their voice correctly. I will brainstorm, mind map a whānau-led plan with whānau, which we will build on as things roll out. When with whānau, we look at what's on top for them, not at what agencies have told me should be on top for them. And we park things for when they are ready for support, e.g. I'll get my driver's licence once my NAN's coordinated care plan is in place. I will co-visit with other agencies in role, and I find this helps me reflect on my own communication style, whether I made sense to whānau, while at the same time doing my best to socialise with the other agencies the way of working.
So challenges. We've actually had very few challenges or issues with integrating the Navigator into Supergrans, but I can see the potential. There's been a few speed humps, and I have heard from some other agencies, so I think it's important to show some balance and present that here, but with the knowledge that I believe each of these things can be easily overcome when people put some time and their mind to it. Number one, for some organisations, the role of the Navigator might look quite different to their typical business as usual. A Navigator's role is flexible, dynamic. Their tasks and timetables will change considerably day to day. They may require a lot of out-of-office time or time up with their Manaaki coaches. A Navigator has a different database to the rest of the team, a different system, some different reporting lines, and to some people that creates different expectations. This could lead to a navigating feeling othered or isolated in their own organisation. Some ways we try to mitigate this is ensuring the Navigator is fully integrated with everything to do with our team, just like all of our other kaimahi. We also have other Navigators often popping into our office, socialising the way of working together, sharing ideas, testing systems together, and ensuring that all of our other staff are really clear to understand what is the way of working, what are the outcomes that we're seeing, so they understand each other's roles.
An example, CCS had not had a Navigator before, and I had never been a Navigator before. So a challenge for me was balancing the expectations of the provider, which at times could have a business as usual approach, versus the flexibility of the Manaaki Tairāwhiti way of working, which I was still figuring out what even meant. This could be isolating at times, as the staff at CCS had a clear KPI system, and would wonder why I did not have to stat my time in increments of 15 minutes in order to secure funding. I was also perhaps seen as an extra pair of hands to help them with their business as usual, e.g. organising support workers. While I was able to capture whānau voice in a spreadsheet at this time, the staff at CCS, like many other agencies, would need to allocate whole days so they could input their stats from that week to evidence to funders exactly how they had spent their time. Also, if I was to miss a Manaaki Tairāwhiti Navigator hui, I would imagine it would be easy to fall into the business as usual kaupapa. And I feel that the time at Manaaki Tairāwhiti is an opportunity to remind myself of the purpose of this role. In current times, I feel that there is more collaboration than the earlier stages.
I've also seen how in some places navigators can feel that they're getting overloaded. I think people are really seeing the great outcomes, the quick success that navigators are having, and then pushing a lot of their work to the navigator, even though it's work that anyone and everyone could be doing. So the navigator does need to build confidence and be able to stand on their own 2 feet, get the support and the coaching to be able to push back when needed to ensure that that doesn't happen, and that they're able to coach people into their own roles instead of taking that on.
Over time, I have had a growth in my own personal confidence and in my understanding of what the way of working means. I am now more likely to ask why agencies in role can't respond to whānau voice, offer information and advice to leads already in role, and do my best to socialise the way of working with those already working with whānau. Once I was asked to come on board to assist a whānau with a claim form other practitioners did not know how to fill out. Instead of responding to the agency demand and coming on board, which is just another car down the whānau's driveway, I responded by teaching the practitioners in role how to do the form and provided them with a template for other whānau to use for future claiming. Prior to this confidence, I was more likely to take on most cases that came my way, which at times could be quite overwhelming.
Part of the Navigator's role is to also socialise the way of working, which means I believe that it's a lot easier if they're in a team that's supportive, people are on board in management and leadership roles, the other team open to looking at things differently, open to being flexible. It could otherwise be quite challenging for the Navigator to do that piece alone, but once again with the right coaching and support, then I think they can be fully integrated. I also know that if I was new to management, which I was in this setting, and if Rosie was new to being a navigator and working in this way, it would take a lot more work to really understand how it all fits together. But as she had the experience already of a navigator, it made it a whole lot easier, and she was able to coach myself and the rest of the team as well. I guess the last thing I'll state is the system itself, and while a navigator can be flexible and while our organisation might be doing our best to try to respond differently, look at things differently, in many cases, as everyone said, the system can still be really rigid, and if people aren't open and flexible to looking at things in new ways, especially when you're very excited about it, like our team are, it can lead to frustration and it can lead to people feeling let down. So it's about building that inner strength to be able to push on through that and know that it's all helping in small steps and small changes. Debs won't like my quote there. It's very, very untactful. Sorry, you're the best data person in the world. You'll make any data make sense. So for me, this work with Manaaki started when I jumped into the carer support project run by Michelle at Manaaki and started looking into systems improvement. Before this way of thinking was all new to me. And then soon after, we got the Navigator. So prior to engaging in this work, the data that we collected at Supergrans was plentiful, but perhaps not always purposeful. So here are just a few small things since engaging in this work that the data has assisted with what we do. As Leslyn mentioned, the Prime Minister came to Supergrans to highlight charitable organisations and the amazing things that we do and how as a region we can come together in the charity and NGO space to collaborate. I was able to contact Manaaki, who pulled together relevant community statistics, highlighting our community need around Kai, and therefore we could give statistically accurate reflection of the current state of Tairāwhiti on a whole as reported by the people themselves, instead of just relying on our own internal data and systems. We could then use that to highlight our needs as an organisation and what we needed, the money from government. The other thing that I'll say is contracts. It's helped with our rigid contracts. We'd had a contract that had been long-standing for about 12 years, and it was set very heavily on outcomes. And we had about 40 others, we called them, each year that didn't really fit into the contract, but we needed to help these people. They kind of aligned, but they didn't count in our numbers, but we were still going to do the work because it was important. So based on data we received and based on my growing confidence about the systems thinking in different ways of managing contracts and different ways that systems could be structured, I had the confidence to evidence, but also to question the long-standing contract, to push, to meet with contract managers, to debate wording and intent of contracts, which can often be ambiguous. And the contract has now been adapted. In fact, it always could have been. It was all in the wording. So for the 12 years, we'd been doing all this extra, well, like you wouldn't call it waste work because we're helping people that we weren't paid to help and just doing the stuff. But so for 12 years we were doing all this extra work that was never caught in our numbers over and above, and actually if it was questioned and pushed more strongly, we could have found that it was flexible enough to meet needs. Another thing that it's helped us do is look at our service provision. So when Rosie came in role and was responding to whānau needs, she found that people that were often coming to Supergrans for a kai parcel actually had many other and more urgent needs. This is something that we would have missed before, before having a navigator. The navigator had time, space and flexibility to talk to whānau, to ask what they really need and to respond to that. This led us to interrogating the data further. We started to look at why do people come in? When do they come in? How often do they come in? We started to make sense of what they really need versus what we had to offer them on our little tick box of services that they could choose from. So based on this, and what we discovered, we created a new kai delivery model, and whilst it's not perfect, we're able to take in whānau voice and needs a lot more clearly, and it steps us closer to upholding choices, voices and values instead of giving people a kai box and sending them on their way. Data showed that people do not need or want all the food in their kai parcel, so we've created an awhi top-up pack, which is based on what people choose and need, specific types of meals, etc. Data showed us that some people want kai support but don't want to attend workshops with others in the community. So we've created a brand new role called a kai navigator, a role that is completely flexible to respond to any needs around kai in a similar way to a navigator. We received a contract for a financial mentor, and we're just developing the service in a way that is holistic and completely on whānau identified financial goals instead of budgeting of old. This work is obviously not the end game, but it has helped us be more flexible and support people's needs further.
These are just some whānau. It's an example of the sort of things I might respond to. And it's, a few things. So whānau 1, this working whānau had a high needs disabled son. They needed a new fridge, a new bed for their other son, support with debt accumulation, and were described by agencies as having poor mental health. I met with whānau, applied the way of working, and soon learnt this whānau were not accessing any disability support and had not been for 17 years. They did not know they were able to, and they just assumed they couldn't as they were working. Once connecting them to the right agencies and walking alongside them, they are now accessing full entitlements through individualised funding based on disability needs of $60,000 a year. They no longer have debt and are living their version of a whānau flourishing. Whānau 2. This whānau was receiving a kai parcel every single week. When I asked what was happening for him, I soon learnt he needed an ID so he could open a bank account to show wins so he could access his benefit. He couldn't pay for the ID as he didn't have a bank account. After communicating with Work and Income to prepay the ID amount onto his green payment card and supporting him through this process, he now no longer needs the kai packages as he can access his benefit. Whānau 3. Without pressure of timeframes, I have been able to walk alongside a whānau for a few years. The student had a school attendance rate of 2% over 2 years. After connecting her to a mentor, collaborating with Kāinga Ora on an inter-house transfer, considering transport options so she did not have to share a taxi with her disabled brother who was triggered by her, offering advice around the routines, and finding a school that was a right fit amongst navigating many, many other whānau needs. This student now has a 100% attendance rate and has had this for the past year. Whānau 4. I have been walking alongside a whānau and with their consent, approached the Jobs and Skills Hub about a potential demolition of a fire-damaged home. This whānau had no insurance. This is equally an opportunity to upskill local people on the ins and outs of demolition.
Just the other week, I sat in a hui with 5 people. There were managers, kaimahi, social service leaders across a number of organisations and sectors. There was no navigator in the room. We were discussing a contract and a different service design. All the people in that hui started talking about the systems improvement work. They started using the words of whānau voice, responding to need. They were using the language. They had all been connected to the way of working or heard about it in some way. They got excited knowing others in the room understood what they meant, and it meant we didn't have to spend so much time discussing following whānau voice and how to design a system. It helped us quickly to get on the same page, and I can see as more people are socialised into this thinking, the more likely they are to quickly embrace it and all step towards a same common goal, and knowing that people want to work in the same way. So I just want to finish with a final insight. My background is in social work, social management. I was a social work lecturer. I've published articles on social work and have done a lot of work supporting mandatory registration of social workers. I have an extremely high opinion of social work and professionalisation of our sector. So when I first heard about Navigators, I was a little sceptical. I was a little apprehensive and wary. How could people from many different walks of life, many different professions, jobs and experiences jump into walking alongside whānau who are facing complexities and challenges in their lives? And I can honestly report that 1 year on, I have changed my thinking around this. I've seen how this way of working can seamlessly and simply work. I've seen that outcomes achieved, I've seen relationships formed, I've seen clients feeling empowered and getting what they truly need. And Leslyn said we're not getting more navigators, so I'll pivot my ending. No, I'd love to work towards enabling and seeing and supporting more of my team to work in this way. I'd love to see contracts become more flexible to allow us to do it. My team is the most amazing team. They work hard, they are passionate and they are dedicated, and they work outside the lanes all the time. As a new manager of a charity, I'd like to have that confidence built so we can do it even more, because I've seen the outcomes and I can see what it can lead to. Kia ora, thank you.
One thing I want to make clear, and it's to clarify Leslyn's language, so there are 14 navigators in 10 organisations. So Manaaki Tairāwhiti does not want to be a funder and does not want to be a service provider. What we've done through this process has been to test a way of working, which we then want you and the government to contract everybody in this way. So the No More Navigators is to say, don't make us a funder or a service provider. What we're trying to say is the government contracts are the only reason other people can't work this way. And so this is all about demonstrating a different way of working, and it's the MSD contracts and others that limit people. And at the highest levels in government, we are having these discussions to say there's nothing to stop you contracting in this way. And then as per Julie's discussion, we can build in accountabilities that make everybody happy on that.